Many people don't take colon cancer seriously until it's too late, but the warning signs are there. You just have to know what to look for. Some are subtle, others are easy to brush off, and many people don't even know they have it until it's already advanced. I'm making this video to inform you about potential signs you should never ignore. You should not wait for these signs to show up. You should talk to your doctor to see if and when colon cancer screening is right for you. I'm Dr. Adam Barron, and today I'll walk you through 10 signs of colon cancer that should never be ignored. Let's start off with unexplained weight loss. If you're losing weight without trying, without changing your diet or exercise routine, that's something you should never ignore. Colon cancer can disrupt the normal absorption of nutrients in the intestines, especially if a tumor interferes with digestion. But even beyond that, cancer changes your metabolism. It releases certain chemicals that redirect your body's energy in the direction of fueling tumor growth. This leads to weight loss that often happens silently in the background. If you notice your clothes getting looser without effort, don't brush it off. Next is persistent fatigue. Everyone feels tired sometimes, but this kind of fatigue doesn't go away with rest. It's the kind that lingers, making you feel drained, foggy, or short of breath during normal activities. One of the reasons colon cancer can cause this is through hidden blood loss. Over time, a tumor can bleed slowly into the colon, leading to iron deficiency and anemia. That means your red blood cells can't carry oxygen effectively, which leaves your body struggling to keep up. Another sign is a constant feeling that you still need to go to the bathroom, even if you just did. This sensation is called tenesmus. It happens when something in the rectum or the lower colon, like a tumor, presses against the bowel wall and tricks the body into thinking there's more stool to pass. People often mistake this for irritable bowel syndrome or mild inflammation. But if this feeling doesn't go away after a few weeks, it needs a closer look. Sometimes there are no visible symptoms at all, and the only clue is on your lab results. If your doctor tells you that you have low iron or anemia, and there's no clear reason like heavy periods or dietary deficiency, colon cancer needs to be considered. This kind of blood loss happens slowly and silently. A tumor can leak small amounts of blood over time, and eventually your iron stores are depleted. Routine blood work may be the first sign that something is wrong before any other symptoms appear. Now let's talk about ongoing abdominal discomfort. This can show up as bloating, cramping, a sense of pressure, or even a dull ache in your lower belly. Many people mistake this for indigestion or gas, but when it persists for more than a few weeks and doesn't improve with dietary changes, it becomes a concern. A tumor in the colon can partially block stool or gas, causing buildup and irritation. Along similar lines is persistent bloating or excessive gas. This isn't the kind of bloating you get after a big meal. This is more ongoing and doesn't seem to be tied to anything you're eating. A tumor that creates a narrowing in the colon can trap gas and slow the movement of stool, causing pressure and fermentation of undigested material. If you're getting bloated regularly and there's no clear trigger, it's time to get checked. A very common but easily dismissed symptom is a change in your usual bowel routine. This could mean developing new constipation, having loose stools more often, or going to the bathroom more or less frequently than normal. The key here is persistence. If your bowel habits shift and stay that way for several weeks, it could indicate a problem. A tumor in the colon can interfere with stool formation and water absorption. It might cause the stool to move more quickly, leading to diarrhea, or create a physical obstruction, causing constipation. In some cases, you'll alternate between the two. If you notice that your stools are consistently narrower than usual, almost like a ribbon or pencil, that could suggest a narrowing in the colon. A mass or growth inside the bowel can reduce the diameter of the passage, changing the shape of what comes out. Occasionally, changes in the stool shape aren't necessarily a concern, but if it's consistent and not due to something like a low-fiber diet, it needs to be further evaluated. Now we get into one of the most well-known but often misunderstood signs, which is blood in the stool. While hemorrhoids are a common cause of bleeding, they're not the only one. Tumors that bleed can cause similar symptoms. If bleeding is consistent or comes back over time, it should never be assumed to be harmless without testing. It could be the earliest visible sign of a dangerous problem. Finally, the last sign is black or tarry stools. This usually means that there's bleeding from higher up, such as in the stomach or small intestines, but it can also come from the right side of the colon. As blood travels through the intestines, it breaks down and darkens, turning the stool black. If you ever notice this, especially if it's accompanied by fatigue, nausea, or lightheadedness, seek medical attention right away. Colon cancer is one of the most preventable cancers if caught early. If you're experiencing any of the warning signs we discussed, don't wait, talk to your doctor, and get evaluated. And if you found this video helpful, leave a like and subscribe for more medical breakdowns like this, and share it with someone who may benefit. As always, this is not medical advice, just educational information. Thanks for watching, and I'll see you in the next one.